I'm Carla Torres-Zegarra. I'm a pediatric dermatologist and a dermatologist working at the University of Colorado. As a pediatric dermatologist, I take care of patients of all ages, from babies that are coming maybe because of concerns of birthmarks or lesions that show up very early within those first week of life. I also take care of toddlers, school-age kids, adolescents, and also adults at the VA. My approach to patient care is basically individualizing a plan based on what a patient needs and also what they want and what they're bothered by. For example, as a pediatric dermatologist, I see a ton of patients that come with acne. And sometimes they come because they personally are bothered by their acne, and sometimes they may be brought to the clinic by their parents or by a very worried mom or dad. So I really, whenever we discuss skin findings and talk about the diagnosis and what potential treatments we have available for that diagnosis, I always ask my patients, I'm gonna ask you my billion-dollar question, and that is, how much does this bother you? And depending on that answer, I basically then develop a treatment plan. If the patient has a benign skin finding, say a benign mole that parents really want to remove, if the patient is not bothered by it, I'm always going to be by my patient's side and advocate for them, because at the end of the day, if they have a surgery that they don't want, they are the ones that are going to live with that permanent scar. On the other hand, if I have a patient that is really bothered by, say, acne, and they may not be heard at that point by their families, I certainly advocate for them. And if I have a motivated patient that wants to follow all the tips and tricks and a medicated plan to be able to get their acne clear, then I'm gonna be supporting that patient. What I value most about taking care of patients in dermatology is being able to bring back a smile to their faces, whether it is because we were able to clear acne, whether it is because they're no longer itchy and sleeping well because we're able to clear their eczema, seeing those happy parents that are now sleeping through the night because they have a comfortable patient that is no longer waking up scratching or crying because they're so uncomfortable on their skin, is really the favorite part of my day.